Dr. Andrew Gorecki here, and I want to tell you something that took me a while to fully grasp. All those times that a patient texted you, your staff, after hours to ask questions about their exercises, right? That was clinically valuable. I think we'd all agree that that helps the patient and you want to provide that service. It affects their recovery in a positive way. It keeps them on track, right? And until RTM, you were providing that care for free every single time. And not because, you were a bad business owner, but because there was no like mechanism to capture it, right? Until now. And that's what RTM is about. So let's talk about that. Let's talk about how to capture your high quality care so that your patients continue to get better, but you get reimbursed for your time, right? In the traditional outpatient PT, this is built around the visit, right? The patient comes in, the patient leaves, you document, you bill for the visit. Everything that happens between those visits, right? The text, the calls, the emails, the questions, the exercise reminders or modifications, all of that is care, and it's real care, and I believe it's really important. And it affects whether your patient is going to progress or plateau or whether they, complete the program or drop out. But it's never had, a billing code or a way for you to capture that time, your time as a provider or your staff's time as a provider. And so practices have been providing it just informally, right? And some practices limit it because they literally can't sustain providing it for free, right? Some practices let it slide and they just watch patients fall off because there's really no structured support. And so neither of those outcomes is great, by the way, and both happen. And it's because the system was really never designed to pay between the visits, right? That between visit care. And RTM changes that, right? There's now specific billing codes that are covered by Medicare and most other major commercial insurance companies that they're for monitoring, communicating, oversight, exercise modification, engagement that happens between visits. And it's really the care that you're already providing. It just became billable. And so I want to walk you through, what actually triggers RTM billing, and I'll try to keep it as simple as I can. RTM is really built around two things: remote monitoring of the therapeutic response and the therapeutic communication with the patient, right? The patient needs to use an app or a software that logs, they can log their exercises and report how they're doing. And that's the monitoring piece, right? Your team, in our case, we have remote PTAs and remote OTAs. They review the data and they respond to anything that needs attention. So any question the patient might have, they reach out to the patient once a month. But that's the communication and the clinical oversight, right? It used to be 16 days of monitoring needed to happen in the calendar month. Now it's less than 2, or it's 2 or more. But that's the threshold for most of these primary codes. And that sounds like a lot, but it's 2 weeks. The 16 days was 2 weeks, but now it's 2 days of the patient actually logging their activity. And when you have an app like ours, it makes it easy, and the exercises are personal and they're video based. You can give them resources as well, like PDFs, educational documents, and that helps the patient hit their thresholds consistently, helps them get better outcomes. But the key thing that I want you to understand is that you're not creating like new clinical work. You're just documenting, or the software that we have is keeping track of the documenting and the structuring that was already happening informally, right? The check-ins that used to happen in the parking lot after a session or before a session, those are now billable. When you run into a patient at the grocery store and you're talking about their home exercises on the weekend, that's reimbursable. The text message, questions about whether a certain exercise should match, or the email that you get, those are billable. The engagement that keeps the patient from quitting in week 3, that's billable, right? That's the shift that RTM creates. And I think it's important to really think through that, right? It's what you're already doing. Here's something I didn't really expect. When we added RTM, my PT started to feel differently about the between visit support, right? Before RTM, the texts and the calls and the after hours felt like an unofficial tax on their time, kind of like documentation does, right? You're always doing that in non-billable time. But they cared about their patients, so they responded, but it wasn't sustainable, and it was kind of burning them out. And there was no structure around it, so it was just happening kind of whenever. You're responding almost to like these urgent messages. And once we had RTM in place, that same care now has a structure, right? It was monitored by our remote team, right? It was documented and it was recognized clinically and financially. And as a part of the treatment plan, right? And that shift in how your team thinks about between visit care matters, right? It's not informal anymore. It's not like putting out fires and just having to do it because you feel obligated. It's part of the program. It's valued. It's tracked. And that dignifies the work in a way I think that matters to clinicians, who choose this field because they really want to make a difference in someone's life. They want to provide that extra support, that extra engagement, that extra care, right? I think that's important to recognize. And so I just wanted to share that with you today. My name is Dr. Andrew Grecki. I'm a physical therapist. I have a practice. I also own MovementRX. And if you ever want to talk about implementing RTM, just shoot me a message. I'd love to talk with you. Thanks for listening. Have a good day.